Hello everyone, I am Dr. Parag Telang, plastic reconstructive and facial feminization surgeon and Director and Chief Cosmetic Plastic Surgeon at Designer Bodies, Center for Advanced Cosmetic Plastic Surgery in Mumbai. Today in this video, I am going to answer the most frequently asked questions that many people ask regarding facial feminization surgery. This session will also help you all get to know more about the surgery, and it will also clear doubts that one has regarding this surgery. Facial feminization or facial gender surgery is a combination of procedures that allows an individual to get a more gender affirming facial appearance. As the name depicts, facial feminization involves a combination of reconstructive surgical procedures that alter the male facial features and bring them closer in size and shape to the typical female facial features. The surgery offers a dramatic transformation to achieve a more feminine look, as the changes are made in the basic structure of the skull. Facial feminization surgery includes different surgical procedures to transform all these features in trans women or females who want to transform their masculine features to feminine. Every individual face is unique and needs a unique approach. We at Designer Bodies follow a two-stage surgical approach. Treatments involved in facial feminization surgery: in the first stage, we start with forehead reconstruction, which can either be type 1 or type 3. Now, females tend to have a curved, rounded and well contoured forehead, while males have a broader and higher forehead with a receding hairline. In this surgery, the scalp repositioning is performed by removing a small area of bone above the sinus cavity and thus reshaping the fragment to offer a feminine appearance to the forehead. So, what I have here with me today is a three-dimensional model where the right half is a male facial skeleton and the left half is a female facial skeleton. For forehead feminization, the male forehead is thicker with a thicker brow bone, while the female forehead is slopier and has a gentle rounded shape. So, to convert a male forehead into a female forehead, we employ either a type 1 or a type 3 reconstruction. In a type 3 reconstruction, the outer table of the frontal bone is removed, it is reshaped on the table and then it is put back, and that is how we create this female kind of a smooth forehead shape. Hairline advancement: the treatment is a best option to feminize the forehead height and hairline shape, as it dramatically shortens the forehead. Orbital contour is the surgery to give a smooth contour between the forehead and the nose by altering the size and shape of the orbital bone. Eyebrow elevation helps to reposition the eyebrows at a higher location, and this offers a high curvaceous kind of an eyebrow which looks more feminine. Rhinoplasty is the most popular surgery to feminize a masculine nose. Blepharoplasty is for the under eye bags. This surgery makes the face look more youthful and young by making changes in the eyelid area. Cheek augmentation is a surgery which offers forward projection to the cheekbones and fuller cheeks, that increases the projection of the mid face and makes one look more feminine. Now, the procedures involved in stage 2 are chin reduction and jaw contouring. The surgery of reshaping the chin area is important to create facial harmony. Buccal fat pad removal is the deep buccal fat pad which is removed to achieve a slim, thin and feminine appearance. V-line jaw shave is removal of excess part of the jawbone to make the wide face look more feminine, and it softens the jawline to make it look more feminine. Lip augmentation: in order to get plumper and fuller lips, we do lip augmentation either with the use of dermal fillers or by using fat injections. Voice feminization surgery and Adam's apple shave: the surgery gives the throat area a feminine appearance, as males have a prominent Adam's apple. In voice feminization surgery, the voice pitch is changed to a high pitched feminine kind of voice by making changes in the vocal cord. Sometimes all the surgeries can be done at the same time, or some prefer to undergo every procedure one by one. The second stage procedures are normally performed after a gap of 1 week. Now, every surgery is associated with some kind of risk and pain. The perception of pain is subjective, and in general many patients share that the pain is quite low. Many patients in fact do not need any type of medication for pain. Many people require post-operative analgesics which are routine. Undergoing the treatment from an expert reduces the risk of any pain or discomfort after the surgery. Every face has its unique feminine or masculine characteristics. In general, all the healthy individuals who are not suffering from any kind of health issue and want to get a more feminine appearance can undergo facial feminization surgery to get a feminine look. Consulting a facial feminization surgeon can also help to evaluate if one is an appropriate candidate for this procedure. Next, the most important question is, now it is very important to choose an experienced FFS surgeon to get the best surgery results. The doctor must be an expert plastic and maxillofacial surgeon who has undergone extensive training for the surgical treatment of the hard areas such as the bony parts and the soft tissue parts of the facial region. Plastic surgery carries out work in the soft tissue, and somebody with expertise in maxillofacial surgery will take care of the bony part of the facial skeleton. So, combination of both helps one achieve great results. I mostly prefer surgical procedures that are minimally invasive and help my patients achieve natural looking results. Most of the incisions of the facial feminization surgery are hidden in the area so that they are not visible, either in the hairline or behind the ears. They also tend to heal quite well. If the patient is prone to forming keloid scars, we offer a variety of treatments that helps reduce the appearance of post-surgical scars. Very important that facial feminization surgery must be performed by the experts, and to get success is when surgery is performed by strategy and using the right technique. There are many surgeons around the world who perform FFS surgery. For the best possible results, the patient must choose a surgeon who performs facial feminization surgery regularly and for many years, so that one can rest comfortably in the knowledge that you are in good hands. During consultation, the patient first describes the area of the face that they want to improvise. Like if they talk about the shape of the nose, the chin, eyes, eyebrows, cheeks, based on their expectations and on the basis of their assessment, ideal plan is recommended for the surgeries. I then try to make sure that the patients are fully satisfied and they are able to get the desired results with the surgery. As the surgical planning depends on the goal of the surgery, most often to deliver the patient's desired goals, several procedures and interventions can be considered. The aim of the surgery is to feminize the appearance of the face by maintaining the essence of what essentially is you. The final result is that you feel more feminine, and there are many patients who share that they feel more self-confident and with greater self-esteem after a feminization surgery. I basically opt for two-stage facial feminization surgery, but it all depends on the type of case. The main aim of the surgery is to keep the patient's safety on priority, and the surgery is performed after considering the patient's age, and I also adapt plans to healing and ensure faster recovery. The safest approach is that where the patient is not under anesthesia for an unsafe amount of time. Hence, surgery is performed in stages than in one stage. In first stage, the upper part of the face is the target. In the second stage, lower part of the face is the target. The surgical length depends on the type of the procedure or the number of procedures performed. The more complex the procedure, the longer the time that it takes. In many cases, some people are looking for a non-surgical way to achieve a feminine appearance, or when little changes are required to achieve a feminine look, then sometimes non-surgical methods can be used to give the desired appearance. This could be by the use of dermal fillers, where the treatment includes use of HA dermal fillers to achieve a plumper and voluminous look. Dermal fillers can be used for lip augmentation, for chin augmentation, chin enhancement. Using correct fillers, we can augment the under eye area and also the nose to change the appearance. Botulinum toxin or anti-wrinkle injections can also be used to remove aging lines to achieve a more youthful look. We also now have the option of thread lifting, which is performed to correct sagging skin and contours of the face. At the same time, unwanted laser hair reduction is also a popular treatment to remove unwanted hair from either the face or the body. Transgender individuals can get rid of unwanted hair from the beard, upper lips, chin, neck, shoulder, other body areas, and this helps to achieve a smooth feminine skin appearance with permanent hair removal. After the surgery, the patient is recommended to eat soft foods or liquids for 3 to 7 days. One must not put any pressure on the treated area. So, in procedures like rhinoplasty and jaw contouring, the patient must not pressure the middle and lower areas. In jaw contouring, the mouth will sometimes be sore and it will be difficult to eat hard substances, hard foods. So, if the patient is not able to chew food, they can take nutritional shakes and a liquid diet. The patient must avoid drinking hot drinks like tea and coffee, and of course smoking and alcohol is to be avoided for 1 to 3 weeks to allow the incisions to heal. The patient needs to take at least 1 week off their work to prepare for the surgery and undergo treatment and for post-operative appointments. The swelling after the surgery will normally subside in 1 to 2 weeks. Bruises usually disappear in 1 or 2 weeks. Sometimes one may need to use a little bit of makeup initially to hide small bruises that may remain. Patient must take rest for 2 to 3 weeks after the surgery. So friends, these were the commonly asked questions on facial feminization surgery. If you liked this video, please feel free to see our other videos on YouTube where I have described facial feminization surgery in greater detail in terms of the chin contouring, rhinoplasty and forehead feminization. If you like our videos, please subscribe to our YouTube channel Dr. Parag Telang, and don't forget to press the bell icon. Feel free to like and share our videos on YouTube. I thank you all for watching this video, and hopefully we'll soon be back with further videos on facial feminization surgery. Thank you.